Hi, my name is Dr. Charles Claps. I'm an orthopedic surgeon at Resurgence Orthopedics, specializing in hip and knee replacement surgery. Robotic-assisted surgery with Mako Smart technology is used for both hip and knee replacement surgery, where we take a CT scan of the patient's joint, whether that be the hip or the knee, to use a customized patient-specific plan based upon their anatomy and a 3D model of the joint created by that CT scan. The benefits of Mako Robotics is that the knee replacement surgery is customized for each patient. Before the surgery, a CT scan is obtained, and that CT scan builds a 3D model of the joint. That 3D model is used to then preoperatively plan for the surgery, where the implants will go and where the bony cuts will be made during the surgery. Then we're able to take that plan and bring it into the operating room. That computer program allows us to modify our plan based upon what we see during the operation, and then that plan communicates with our robotic arm that we use during the procedure, so that we're able to implement the plan that we've come up with and then change it if we need to. The robotic arm makes perfectly precise cuts, and we can ensure that the patients will have the best chance for the best outcome possible due to the customization of the surgery just for them and with the help of the robotic arm.